much for coming to the Teaching Educations today. I'm here to elaborate more about the ILO 4, which is the demonstration of a closed safety system of administration using the intravenous hazardous drugs process. We have covered this in the lecture sessions, and I want to reiterate as well why is it really important for us to use the right TSSA technique, because it could cause a potential harm for the healthcare workers, to the surrounding environment, and also cross-contaminations between patients can occur. So this is why it's very important to use the correct way of using the closed safety system of administrations while administering IV hazardous and utilizing the right PPE. We're going to approach the skills with a C1, do one, and a teach one activity. So in the C1 component, we're going to perform the clinical skills, and I will explain the step-by-step component of this approach utilizing the hazardous drugs guideline. In the 2-1 sessions, this is when you're going to practice yourself. Practice as much as you want, and it will be a performance checklist, so basically to guide you what are actually looking forward, and you can always refer to the practice of the skill itself. I'm also going to give you a visual aids what the cytotoxic trolley actually going to look for, and there's going to be a step-by-step guideline to provide you in the practice section. So after that, I'm going to ask you guys to do a teach one, which is when you're going to teach all of the practical skills back to us. Now, before we start, I would like to highlight a couple of points. In these sessions, I will be coming around and give you guys the feedback based on what I observe, and briefly go through some technique required to ensure that you're performing the clinical skills safely and what you could do differently in the future. So this is a safe environment for the practice skills, but in the real life scenario, when we are administering the IV hazardous drugs for our patients and we break the closed safety system circuit, it could actually pose a substantial risk involving the occupational health and safety. So there's nothing personally about this feedback. It's more of to give you what we can do in the future, and because it's going to be relatively casual as we all know each other and we work together as well. So essentially the feedback that I'm going to provide will comfortably be utilized in the teach back session. And I would like to reiterate that if we can please respect one another, restrain from calling back or talk over, so we can please be having a positive environment during this sessions, okay? So, and after this session, I will go through individual feedback. We will do this discussion in the conference room outside, and I would like to ask if you could reflect on the area that you think you want to improve in the future. Rather than giving feedback, we will discuss what approach and skills you would like to concentrate in the future to enhance your skill set. All right, let's get started. All right, guys, so for this practice, we need to have the correct PPE on first, and this is our cytotoxic trolley. So I wanted to run through with you what is actually in the cytotoxic trolley. So first of all, we have the fluid maintenance that are compatible with the cytotoxic medication. It could be glucose or just the normal sodium chloride. We have the cytotoxic medication. We have extra labels just to label what are actually cytotoxic. We have the alcohol swabs in here. And the most important thing, we have the primary line, okay? We also have a secondary line that's always come with a hanger to help us to hang the medication and also the fluid maintenance. All right, so first of all, we're gonna prime the fluid maintenance with the primary line, okay? So we're gonna do that. Okay, beautiful. Cool. Beautiful. After we prime it, noted that we have 2 hubs that we can actually connect some medications. So the one, it is above the Alaris pump, as you can see in here, and the other one is closer to the patient side. So when we're going to establish the closed safety system administration, we need to use the one on top of the Alaris pump so that we can program it during the channel. Okay, so we scrub the hub for 15 seconds. And then 30 seconds dry, pretending that we've done that. And then we connected the secondary pump And then let the gravity do its thing. And as you can see, the chamber's now filled with the fluid maintenance. All right, so we have done the piggy bag or the back priming. So the chamber for the secondary line are now filled with the fluid maintenance. What are we going to do next then?
We're going to pierce the cytotoxic medication.
Yeah, beautiful. So we're going to pierce this cytotoxic medication on top of the liner. And then which one of these that we need to hang higher in the pump?
You would hang the cytotoxic medication, the drug, higher.
Yeah, so the cytotoxic medication needs to be above the fluid maintenance. And do you guys know why that happened? Like the medication didn't go to the fluid maintenance, while the fluid maintenance can go to the cytotoxic, and this one doesn't.
Because of the valve?
Yeah,
on the line.
Beautiful, that's it. So we've got a valve here that prevents two ways and only one way to go into the line. Lovely, and now we've got a closed safety system administration for IV hazardous drugs.
Yeah.